Hello, everyone. This is your Vibe Mistress, Stephanie Renee, welcoming you to another episode of the Sick With It podcast. It is October, and as many of us know, October is widely recognized as Breast Cancer Awareness Month. For those of you who don't know my personal story, this is absolutely personal for me. I lost my mother to metastatic breast cancer when she was just 39 years old, and I was just 11. So that idea of what this disease can do, the fact that it is still so prevalent 40 years later, is something that we need to talk about, and certainly need to hear from people who have been on that journey themselves and have successfully reached the other side. We need to hear about what that journey was like and what we all can do, men and women, to make sure that we are checking for breast cancer and doing everything within our power to prevent it. So joining us to help share some of her journey is one of my very good friends, one of my fellow Penn alumna, and someone who has a personal story to tell in this regard. Her name is Tanya Dooley Adija, and she joins us now. Hello, Tanya, and welcome to Sick With It.
Hello, Stephanie. Thank you so much for having me.
Yes, indeed. Well, I appreciate you saying yes, because coming through the pandemic, as if that wasn't a big enough deal for us personally and for the world, we got a chance to reconnect face to face for the first time after both of us had to deal with some real serious health challenges at a collective alumni weekend. And from there, we have started to talk about and be more aware of each other's journeys in this regard, this idea of recovery, what that even means. So I thank you for wanting to share a part of your story. So let's kind of go back. We are at an age now, I think, where we're starting to realize, I mean, not that we ever thought we were invincible, but the little aches and pains and the little other things that are happening with us are coming with more frequency. And so,
Exactly.
what was the first indicator to you that something wasn't quite right in terms of your physical health?
Well, I have to say that it was during the pandemic. I was scheduled for my annual mammogram, but because of the pandemic, should I go? Shouldn't I go? We didn't really know, is it sterile? Is it what's going on in the hospital? Everyone was scared. And so I called and they said, just come. Everyone's separate and you'll be fine. So masked up, did all the things, went in and just thought it was a regular mammogram. And then they called me back and said, we want to do an ultrasound. And I said, okay. And I didn't really think anything of it. They have told me in the past I have dense breasts. And I know a lot of women have heard that. They don't
And
really
particularly Black women.
exactly, and don't necessarily know what that means.
Mhm.
It just means that your tissue is more dense than other people, and it can show up and look like cancer sometimes. And so that's what they told me. Come back, and I had an ultrasound. I'm laying on the table, and the woman's doing the ultrasound. And what I love is that they're like, and then they go over one particular spot they seem to linger in that
Yeah.
area. But then they're like, I can't tell you anything. It has to go to the radiologist. And, you kind of panic a little bit, but you try to keep the calm. And, but I kind of knew. I kind of knew. I'm in public health. And I just had an inkling. And so the radiologist came back and they said, yeah, we see something. And so from there, it just was like a snowball. And I had multiple doctor visits scheduled. And, to be honest, like pandemic, what? Like all of that went out the window
Right.
because I was like, okay, get me in to see whoever I need to see. And I don't care. I put on 5 masks and go in to see the doctor. So
Mhm.
I was then scheduled to see a breast specialist
Mhm.
who then did a biopsy. And then I had to go back after the biopsy. And I think that wait was kind of really excruciating.
Yeah.
Like, it was probably about a 2-week wait, and
Mhm.
I think it was over, like, the Thanksgiving holiday, and so it was hard to really enjoy,
Mhm.
that time, because all I can think about is my test results. When is that date coming? When is my appointment coming? And finally it came, and I went in, and I think I may have posted this on Facebook, and we'll talk about that later, but I saw the chart before I sat down.
Mhm.
She had the nurse practitioner had highlighted my diagnosis, and I saw the drawings and everything. My eye just immediately went there to the chart,
Right.
and my heart sank. So,
Let's
yeah.
pause there for a second because
Mhm.
the multiple steps to get you to the official diagnosis is a process that I don't know that many people are familiar with, A, if they have not been getting their mammograms on time, or
Right.
if they've never gotten an abnormal one. So I think it's important to sort of go through that. And the first question I have is, did you start, because there's been some conversation, I guess we can say, among the medical community about when you technically really should start getting those mammograms? Some people say 40,
Mhm.
some people say 45. Do you have a family history, and did you start at 40, which was the recommendation, I guess, about 10 years ago, when that would really start applying to our peer group?
Right. So for our peer group, I did start at 40 just because that's what we were told to do.
Mhm.
Um and I know that you're into ancestry and documenting all that stuff.
Yeah.
Unfortunately, my coming from, and might not just be the islands, but um our ancestors or elders didn't really share medical history. They're not
Okay.
very open with medical history, like we're trying to be a little
Yes.
more open, with our kids or our peers or the younger generation.
Yes.
And so, I had heard stories that some family members had maybe had a lump, or my grandmother had a mastectomy, but she didn't have breast cancer. And I was like,
Mhm.
why would she have a mastectomy if she didn't have breast cancer? And they were like, that's what they did back then. If they thought it was something, they just gave you a mastectomy. And that didn't really sound right to me, but I was like, okay, I'll go along with that.
Mhm.
And so I think maybe there was some family history, but it was unclear.
Right.
But at any rate, like I said, because I was so health conscious, because I worked in public health, I just was like, okay, 40 was the time that they told us. And because I'm, kind of a rule follower, you know, I
Right.
said I'm going to go at 40, and then I went kind of religiously every year
Mhm.
since 40.
Yeah. The other thing you said that I want to stick with for a minute, because I think it's important for us to know ourselves, to know our bodies. You said you kind of knew what,
Yeah.
in this process that we are going to go back and talk a little bit more about as well. But what was that knowing? What was that inkling? What was that feeling that you were processing even before you got the diagnosis?
I don't know if it was necessarily anything in my body, but I just felt the energy of the lab tech
Mhm.
and the energy from the radiologist as they were giving me my results.
Mhm.
And so, I'm pretty in tune to how they're speaking without speaking.
Yeah.
And whether they know it or not, people deliver news differently when it's positive versus when it's negative.
Yeah.
And so they gave off a vibe that it wasn't so great.
Mhm.
Um, and so that's how I knew.
And so in this context of the process, right? The different kinds of procedures that you had to finally get to your diagnosis. Let's start from the beginning. So we are
Mhm.
always told that you're supposed to have an annual mammogram. Like I said, we were told 40. Now they're saying
Right.
45. If you have a family history, there's some other advice that's given as well. I had my first mammogram when I was 15 in my medical exams to apply to
Mhm.
Penn
Okay.
because of my family history. And
Mhm.
they found I have had a lump in my left breast since my teen years. So probably
Oh,
since
wow.
around puberty. Right.
Mhm.
So for me, those annual mammograms are important because they're always monitoring to see if that lump changes.
Changes, right.
And you know, knock on everything, thank all the stars in the heavens that it's
Mhm.
been benign my whole life, but it's been there.
Right.
Right. So
Right.
that whole specter of the at any point the news could be different is real.
Right.
But what happens is if they think they see something, like you said, now we move to ultrasound. And
Mhm.
so for people like me who have not had children, you need to know that it's everything that you see on the TV shows with the gel and the wand,
Right.
right? Going up, over, and through so that they can try and get some imaging that then also has to be analyzed.
Right.
And so was that the first time that you had, you know, basically had that level up in terms of taking a deeper look?
No, because they had told me prior that I had dense breasts,
Mhm,
in years past.
mhm,
So, that was not the first time I had had an ultrasound. And so I wasn't that's why I wasn't as nervous going in, but the the tech that did it, I could tell based on her reaction
mhm.
that something was amiss.
Right.
I do want to back up before the mammogram. Let's not forget self exams
Yes.
because we're a little bit, some people don't like to touch their own bodies. And that's very important because a lot of people who don't go get mammograms for whatever reason, they can't afford it. They think they can't afford it. They don't have insurance or what have you. A self exam is really important. And so that should be done monthly.
Yeah.
Feeling all around the breast. They have shower cards. People can look online for diagrams on how to do a complete and correct self exam. So I didn't want to leave that out.
Yeah, no, thank you for that. And we'll make sure that we include a link in the show notes and on the website as we post this episode
Mhm.
for people to be able to link out and get some of those resources because, like you said, they are incredibly important. And
Right.
then, so, you know, like, the idea of how we continue to ramp up. So after all of that, then there's the biopsy. Now, I can
Right.
I mean, I'm not trying to show everybody my cleavage, but I have this little scar now is one of
Hmm.
my reminders of my first biopsy. And it happens in a number of different ways. I happen to have a slate of doctors at Penn Med. So, you know,
Okay.
alma mater into the medical system. I'm all in
Right.
it. And there are varying levels of biopsy, but the idea of what you experience is always going to involve a needle
Hmm.
and getting some tissue to
Right.
determine whether or not those cells have any abnormalities that need to be discussed. I told you
Right.
all about, for me, I've had a lump
Hmm.
in my left breast. So they needed to get samples of that tissue and
Hmm.
they inserted metal clips so
Hmm.
that
Yes.
for subsequent imaging, they could see if they've shifted, which might indicate
Right.
that something is wrong. So,
Right.
you know, people need to understand that mammograms are necessary, but if there might be a problem, there's a sort of amping up of steps so that they can get the clearest picture possible about what exactly is going on. And so, you know, you like I did, have gone through
Hmm.
all of those steps. And so here you are now
Hmm.
with the images, with it highlighted, with
Hmm.
the diagnosis.
Right.
You are a wife and a mother. And
Hmm.
so having it in front of you. how did you begin to process not only what the course of treatment would be, but what the
Hmm.
level of communication would be around this diagnosis?
Well, so it was a lot to process. And obviously, the first thing that I think about is my family. And, what does this mean? What kind of cancer is it? Because they don't really tell you, they can't tell you what stage it is or how bad it is until you go through surgery or, other procedures. They can just tell you have something. And so, at first I said, I'm not going to tell the girls until, I go through some of the other procedures till I get to a certain point.
Mhm.
Um, Obviously, I Yang, my husband, you know him,
Mhm.
so I say his
Yeah.
name, but Yang was with me through all my appointments, so he already knew.
Mhm.
And so I had to then do an MRI and schedule surgery. I decided to do that when they told me the size, the breast specialist said it was, I can't remember exactly, but it wasn't too big. So I think it was like, I want to say like 1 centimeter or something like that.
Mhm.
Um, so she said her recommendation would be a lumpectomy and then whatever came after that. She was just kind of in charge of the surgery part. And
Mhm.
then once they got the mass out, they would then send it to the lab, and that would determine whether or not I would need chemotherapy, or I would need radiation only. And so that's another stage
Right.
and hoop to jump through. So the decision to do lumpectomy versus a mastectomy, because her recommendation was the lumpectomy, but she said, it's my decision.
Mhm.
And so I had to decide, do I do the mastectomy and say, just get rid of it and be done, or do the lumpectomy and I would have to forever be monitored and do mammograms and such. So
Mhm.
I opted for the lumpectomy because it was so small.
Mhm.
And so we had to schedule surgery. So all of this happened from diagnosis right after Thanksgiving to surgery was scheduled January maybe 13th, I think. And then
2021. So we're still dealing with
2021.
pandemic, right? I
Exactly.
want people to also understand
Yeah,
that you're making these decisions about this particular situation, still understanding that there's a whole world of other stuff going on around
exactly.
you.
Still pandemic. So actually our girls were home schooling because of the pandemic.
Mhm.
And so um, they kind of sensed something was up because mommy's going to a lot of appointments. What's
Mhm.
going on? Where are you going during pandemic times?
Right.
Like, why are you going out so many times? And so obviously I told them, I wanted to let them know before the surgery because, the surgery. So you never know. So we sat them down and had a conversation. And I think our oldest she was in 7th grade and the youngest was in 3rd grade. And so, they're young, and I had to put it in terms that they would understand. And the oldest they had been talking about cancer cells, funny enough, in biology class in
Mm.
school. And so I used that and talked to her about it like that, because she's very
Mhm.
factual. And just that they were going to take it out, and then I would do whatever medicines that I needed to keep it at bay.
Mhm.
Um, our younger, I just kept it simple. Mommy has to have surgery to take out, some cells that aren't good for my body. And, you know,
Yeah.
but the other thing was that, I kind of had to do all of this by myself because even though Yang was there at the appointments, he couldn't be in the MRI with me.
Right.
He couldn't be in the surgery with me because they were only allowing, he could be in the waiting room,
Mm.
but they weren't allowing people in.
Yeah.
And so, it was pretty lonely to
Mm-hmm.
go through this. And so the surgery wasn't horrible. I did have some, just to back up a bit, a couple angels that I want to mention.
Mm-hmm.
Vicky Ramey,
Mm-hmm.
um, your soror,
Mm-hmm.
talked me through a lot of this because she was going through her own battle.
Mm-hmm.
And our very own Dr. Dawn Johnson
Yes.
Leonard was my angel doctor who gave me the straight facts, and I can't thank her enough.
Yeah. Well, let's pause for a second because I know this
Okay.
is emotional, and
Yeah.
people, it's difficult for people to really understand, even now in hindsight, right? Years behind you, successfully making it through all of this, to think about the toll, about the journey, even behind you now.
Yeah.
It's a lot. It is
I
a
can
lot.
I can
Nobody
go
wishes this
right
on
back.
anyone.
I can go right back. Like, I feel those feelings. It's
Yeah.
crazy.
Yeah.
I feel like I'm in that moment again. So it was hard.
Yeah. Yeah. But here we are.
Here we are.
And people tend to think that, okay, well, you get the diagnosis, you get the surgery, you're good. And
Right.
that's not true,
Right.
because after the surgery, the doctors always have to take a look and see if they
Yep.
got all that they were trying to get.
Yep.
And then, depending on what they find from what they extract from your body, there's some other
Hmm.
decisions to be made about how
And
to go forward. So, you had the lumpectomy, and
hmm
then what information were you given to contemplate what next?
right. So I had the lumpectomy, and when they cut around the lump, they try to get a certain area around there to clear, to make sure, there are no other cells.
Yeah.
And um, I don't know, I can't remember what they did to. I guess they test the tissue in the
Yes.
lab and to figure out if they get what they called the margins. And
Mhm.
for me, they did not clear the margins. So I had to have a second surgery, maybe about a month later.
Mhm.
And so, went through the same process over again and again. And my parents, luckily, my parents came and stayed with us for a little bit to help
Mhm.
out. And that was a blessing.
Mhm.
And then after that, once they tested the tissue, they give you a score, based on your, I guess there are a lot of different factors that they have.
Right.
Your your age, your whether you're menopausal or not,
Mhm.
the type of cancer. It ended up being stage 1A, and they give you what's called an oncotype score.
Mm.
And I remember in the beginning when I was talking to Vicky and she was telling me this, and she kept saying oncotype, and I was like, I don't know what that means. So when I get to it, we'll talk about it. And she's like,
Yeah.
but you just want to be below this number. And whatever the number was, I was right on that number.
Mm.
And all I could think was, what does that mean?
Yeah.
Like, am I, is it good? Is it bad? Are they gonna, so I was still premenopausal,
Mhm.
and so they had referred me to my next doctor, which was my medical oncologist,
Mhm.
and she's the one who decides whether or not you need chemotherapy. And so when she got my score, she said, you're right on the border. And the only reason why she's recommending chemo is because I'm premenopausal. And so somehow my cancer was an estrogen-driven cancer, and because your ovaries are,
still producing,
still pumping out that estrogen, she said, I think you should do chemo. I mean,
take a moment.
Again, my heart sank because I was there by myself. And it's just so much information to take in. One thing I would definitely advise, I know this was a dire circumstances with COVID, etc., but always, always have someone with you, because you're just hearing like the teacher on Charlie Brown. Like, as much as I like to take in medical information, I'm that type of person, but I was like, I'm not hearing you right now,
Yeah,
because
people don't
all I
understand.
heard was chemo.
Yeah, because there is a glazing over that happens because you are trying to be your rational best self so you can make good decisions in the moment
Right.
about what should happen, but the emotional part of you is like, you just said what?
Right.
What? And
Right.
the what wins. The what gets louder in the
Yeah.
moment while you're trying to be rational and process this what next piece of it. So it's important for us to acknowledge that even now it's difficult for you to talk about it, and that in the moment people have to give themselves grace to
Yes.
say, "Yeah, just give me a minute. Give me a minute to really take in what you are saying to me," because our medical establishment, our doctors are generally taught to be very factual, to give you the what, and to walk
Mhm.
you through the thing. But the
Mhm.
reality of our lives is that we are human beings with an emotional meter, right?
Right.
And so sometimes just the facts are not helpful
Right.
in the
I mean,
moment.
and I'm usually good with facts. Like, I'm give it to me straight, and then I'll figure it out. Let me know what are the things I need to do, and then I will, process it.
Yeah.
But this was very heavy. I mean, it was heavy. I just was like, whose life is this? I
Mhm.
I could not I couldn't process it. And I just yeah, it just was a lot to take in.
Right. And
Um
chemo does not mean the same thing for everybody, depending
right.
on your type, depending on how aggressive they feel they need to be with it. So it's also
Mhm.
important for people to understand that one word does not convey the range of what you might experience if this is your diagnosis. So while
Right.
you were trying to fight through the brain fog and I'm not really fully getting what you are saying to me right now because it is a lot,
Mhm.
then you had to get back to that fact side to hear what chemo would mean for you. So
Right.
how did they explain to you what that chemo journey would be like?
So she told me which types of drugs she would recommend. And, she gave me a booklet with the drugs
Mhm.
in there, or handout or whatever. And then she said, and these are the ones that make your hair fall out. And I was like, okay, great. Okay. Um so
People need to I want to pause there for a second though, because I think some people think that that's just vanity talking
yeah.
when you might have a problem with hearing that. It's not just vanity.
Mhm.
This is also a a sort of reckoning, I think you have to do mentally, of the how fast,
Mm-hmm.
how much, like there are layers of understanding that you have to work through when you hear, oh, I might lose my hair, on top of
Right.
everything else. Now and
Right.
this too, right? It's
Right.
a lot.
Right. I was like, and how do I look bald headed? You know, how am I? Um, yeah, that was. So I remember having the conversation with her, like, does it fall out immediately? And she said no. So I had to do 12 weeks, which was once every 3 weeks.
Okay.
So 4 rounds, once every
Mhm.
3 weeks.
Okay.
Which might not sound like a lot, but what happens is you do it the first week, your body, like my first time, my body went haywire. Like
Mhm.
I don't think I could get out the bed for that first week.
Mhm.
And then as I started to feel better, then that's when it was almost time to go back and for the next time.
Mhm.
So I feel such for the people who have to do it daily or have to do those weekly infusions or more frequently or even longer.
Mhm.
Like, I would see so many people coming in and out, and some people coming back who thought they were done, and it's just it's really a tough thing to go through, and again, to go through alone,
Mhm.
because no one could come. You see in movies people sitting with friends
Mhm.
talking and just
Reading them a
having.
book, or yeah,
Yep.
all those things.
No,
Yes.
none of that. It was me by myself. um every once in a while, I think I had, I would FaceTime or video chat, but I didn't want to be out loud with, there are other people there, so I don't want to disturb
Yeah.
um their sessions. Some people were in bad shape.
And you said one session every 3 weeks, but how long was that one session?
That Each session was probably about, I would say, 3 hours. Like they give you IV bags filled
Mhm.
with the medication. So one bag of, I was on two drugs,
Mhm.
one bag of each drug, and then one bag of saline.
Mhm.
And then so by the time, however long it took for that to go through, is how long it took. I think mine probably took about 3 hours each time. So
Mhm.
maybe four. So I was there. And I remember I think the first time they did it, they were titrating it too fast,
Mhm.
and I got dizzy and like nauseous and all kinds of weirdness, and I felt like I was going to pass out, and so it's just taxing on the body.
Yeah.
But yeah,
Yeah.
so
Well,
that
people need
that
to understand chemo is chemical
yeah,
infusion in the body. So for all of the people who, are naysayers about vaccines and the other ways that these kinds of things are delivered, you got to
right.
understand that this, an
Hmm.
infusion, requires that level of adjustment so that you get what you need, but also that you are not overwhelming your body and kind of pushing it beyond what it can filter in order to be able to help you.
Right. And I know there are a lot of people that don't believe in chemo, and they want to do natural ways and all that. But I made this choice. And
Mhm.
so I wanted to do whatever I needed to do to be here for my family.
Right.
And so I remember I told that this telling them that I was doing chemo was harder than telling them about the surgery, because
Mhm.
that part, they didn't learn about that in school.
Right.
And so trying to explain that was hard, and explaining that I was going to lose my hair was hard.
Mhm.
And, um, and so it just was a lot of emotional stress, a lot of mental stress. I felt like the physical, I could deal with better, or I thought I could deal
Mhm.
with until it came and knocked me down.
Yeah.
Um, but, by the grace of God, I made it through. And
Indeed, you did.
yes,
Yeah.
yeah.
And so, whew, so we got a lot of information in that. In terms, you found out that it was estrogen driven, which
Hmm.
is important for people to keep in mind, that there is no one size fits all breast cancer.
Right.
And they all have different treatment approaches. Did you at
Hmm.
any point feel like that you needed a second opinion, or was your communication with your medical team open enough where you really felt like they laid it all on the table for you so you could make good decisions along with them in the process?
Well, like I said, Dr. Dawn was my second opinion.
Okay. Yes, you had the built-in peer group second
I had
opinion.
my built-in pen doctor, and
Yes.
you know, she again gave it to me straight and was like, uh, for your hair will grow back. Do what they tell you to do. And I told her all the details, and she agreed with what my doctor said. And she said, and also when it was time for me to do radiation, because that was my next step after
Mhm.
chemo, she said that because she treats a lot of Black women, the one piece of advice she gave me was make sure they treat the whole breast and not just the site of the tumor, which was good advice because that's what they offered me.
Mhm.
They gave me the options.
Right.
They said they have this a way that they can site treat. They insert something into your scar where they did the biopsy, and it will radiate just where the tumor was.
Mhm.
And she said, don't do that. Well, that was her recommendation.
Right.
I
Yeah.
don't want to, in case other people want to do that. That's,
Right.
that's a choice. But she suggested that I do my entire breast. And so that's what I did after the chemo was done.
Right. And so course of treatment for radiation
Mhm.
was how long?
So radiation was 20 sessions, which is what, 5 weeks daily. So that was
Mm.
I had to drive to the hospital every day by myself,
Mhm.
and I mean, at this point, I was, you know, you just got to let go of all of your any kind of shame you have about your body. Forget about it.
Yeah.
Any, if you're shy, if you're, you just grew up a certain way and you didn't show your body at all, forget about that. Because they're like, listen, we've seen enough breasts in here. Just take it off. And, because I'm kind of I could be a little modest. And
Mhm.
so I was like, okay, are we ready? They're like, listen, could you just take the robe off? And they need to mark up your whole body and make sure that the laser or whatever they're um, is pointed exactly and precisely where
Right.
they need it to go. So that's what I did. And every day I would go there and just lay on a table and you can't move. And
Mhm.
so, when you can't move, everything's itching
Yes.
and you want to move. And so that was probably the hardest part about the radiation
Mhm.
until maybe week, I'd say like week 3, then it starts to burn.
Mhm.
Yes, it's like almost like a sunburn, like a bad sunburn.
Mm-hmm.
and my skin started to get discolored, and it started to turn, really dark, and like burnt flesh. I
Mm-hmm.
mean, it was burning. And so by the end, it was quite painful, and they give you like this silver cream to put on it that helps some. But I
Mm-hmm.
remember that my pharmacy didn't have any at the time, and and so I couldn't get it, and I just remember that being a really bad day, because I was going home thinking I'm going to stop at the pharmacy. It's going to,
Yeah,
nothing can touch. If you, I don't know if you've ever had a sunburn or
I have.
anything. Yeah, if anything touches it, even skims it, it just hurts. And so that was the hardest part about the radiation.
And I would imagine that they don't want to give you local anesthetic because they want you to feel if something is really, really wrong.
Yes. Yeah.
Hmm.
Yeah.
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 Whew. All right. So
So
layers, 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 right?
a lot of layers. Yes.
So from diagnosis to surgery to chemo to radiation,
Hmm.
through all of the course of treatment, do we now go back and get one more? Was everything successful with the doctor before they
Yeah.
officially release you to healing on your own?
Kind of, sort of. So that was, I think that took me to about July. So from diagnosis, beginning of December 2020, all of that took me to about end of July 2021. And then I think August, I had a mammogram, and they told me all was clear.
Mhm.
Um, and so obviously, all is great. Then that, puts me on a multiple checkups with multiple people. I've gained quite a few doctors. I have
Right.
to,
You now officially have a team. Yeah.
exactly. I have to continue to see my radiologist, my oncologist, my breast specialist, my OBGYN still. And, everyone's just checking to make sure that everything is,
Yes.
what it's supposed to look like.
3 years
Yeah.
later, um,
Yep.
what a wonderful thing. But
Yeah.
there's one more piece of this that we have to talk about
Hmm.
that is the really uncomfortable piece for most people.
Yes.
Before all of this, did you consider yourself having, say, the Ferrari level of insurance? Was
Hmm.
there an opportunity for you to add coverage, something that would help make sure that the level of treatment that you received was the best decision for you, both medically and financially?
So, I mean, I just had regular insurance through, I stay at home with the girls. I do consulting. So I am on Yang's insurance through his job.
Mhm,
And so we have pretty good insurance.
mhm.
So I just went to the doctors that are in network with our insurance. So I just thought they were, um and I've been pretty very pleased with my regular primary care doctor, my OBGYN. So as they're referring me to people, I feel comfortable because I'm comfortable with the network that I have.
Mhm.
So I didn't think that I needed to add extra insurance or do anything extra, and things were covered. I mean, we had to pay some out of pocket for the surgeries, um, because as you can imagine, there are thousands of
Yeah,
dollars.
and a lot of people don't
Yes.
know the level of what, because once you go through it, you get a bill that shows you line by line item
Hmm.
how much
Yes.
it cost. the
Yes.
system, right? And
Mhm.
then how much of that is covered by your insurance premium, and then
Right.
if there is a balance, what that balance is. But most people cannot fathom how much it
Mhm.
costs on the front end,
Right.
market price.
I know. I can't imagine how much this would have cost had I not had insurance. And I know that that's a challenge for a lot of people. A lot of people go bankrupt trying to, pay for things, or they just, unfortunately, why we have a lot of the problems we have, they use the ER, or, I mean, now we have Obamacare, which I hear a lot of people talk favorably about it. And the coverage is pretty good there. But it's still uh, astronomical, the amount, the cost of things.
Insurance is not cheap, and particularly,
No.
I mean, what we, I'm not, this is a nonpartisan conversation, y'all. This is just
Right.
the
Yeah.
reality.
Yes.
um the fact that we have a system that allows you to get coverage at all with a pre-existing condition
Mm-hmm.
is so necessary for so many people, myself included.
Absolutely.
That we can complain all we want to about how much it costs, and it ain't cheap, depending on what you need to treat. Um,
Mm-hmm.
all of those things, but just to have the option of saying, in order for my care, I'm going to try and find this
Mm-hmm.
money here, so
Right.
that, so that I have an opportunity to get better, so that at least I can go in and see some doctors to get a proper diagnosis and understand what I'm dealing with. Not,
Yes.
we WebMD and all the other things on Bill Gates' internet do not allow you to properly diagnose yourself.
Right.
We need to leave that to the people who are trained to be able to give us that information. I just think it's important to say out loud,
Mm-hmm.
because your grandmother may have been very well intentioned, and she might know a thing or two about herbs that have been passed
Mm-hmm.
down to her through the generations. But you got to be able to make an informed decision
Right.
about whether that's the best thing for you at any given time. The same way you have so candidly shared with us how each
Mm-hmm.
time you got some information back, you had to go, and let me also consult my people
Right.
so that you can
And
make the best decision.
I was just going to say, speaking of people, I just wanted to also say that we have to do a better job of relying on each other and
Mhm.
not thinking that we can handle everything ourselves, because, and I speak, and we means me. Because I was one of those people that I can do it myself. I can handle it myself. I can take care of myself. But this knocked me down
Mm.
and showed me that there are people who care and want to help. And there were people in my community who set up food delivery for me and the
Mhm.
family. And, I would not have asked for that.
Right.
But they took it upon themselves to make sure that my family was taken care of because I couldn't get out the bed.
Mhm.
Um, and not to say that Yang can't cook, you know, but he's also working full time and making sure the girls are keeping up with what they need to keep up with, while I'm down.
Yeah.
And so, God bless them. And, we need to make sure that we are keeping our community close
Yes.
and keeping each other close.
I want, and I want to double down also on what you said about you wouldn't have asked for that, right? It might not even, I think people might be very well meaning. I'm saying this to the village in our
Right.
listening audience right now, right? People might be very well meaning, but if you come to somebody who's already dealing with all these other decisions about treatment and family and how they're personally feeling, all their own
Mhm.
baggage, and you go, what can I do? You've
Mm-hmm.
just now given them a whole nother set of things to contemplate that their brain probably can't handle.
Right.
So what you've just offered is something that you can do it without asking, right?
Yes.
If
Yep.
you just sent, maybe the idea of food delivery, like you paying for food delivery, is
Mm-hmm.
cost prohibitive for you, but making a casserole of something
Right.
and
Yep.
calling Yang and saying, I'm just going to drop this off, like I
Yep.
don't even need to come in,
Yes. And
the
that's
bag
what
is
people
on your
did.
doorstep. Love y'all. Take care. Hope you enjoy it.
Yes.
Those things mean
Yeah.
a
Mm,
lot
they
to people
absolutely
who are in
do.
treatment. They mean a lot.
Yeah. Mm-hmm.
So,
Yeah.
that we gotta figure out a way to better inform the village about things you can do without having to ask, so that you don't, add to all of the other things that the family is trying to deal with, or that the individual is trying to deal with. We can
Right.
step up and do things that will be of benefit. And that's just one example of the kind of thing you can do that makes a difference. I know people who have not necessarily cooked, but they have done grocery delivery,
Right.
so
Yep.
that there's food in the house, right? You
Exactly.
all, maybe the chemo, you really were not hungry, but you need to eat.
Yeah.
So if there's
Yeah.
some
And
fruit
the
or there's
family needs to eat. I
right, right,
mean, yeah.
yeah.
Um, yeah. And it was very much appreciated. And the other thing I was going to say was that the sharing, sort of like what we're doing here,
Mhm,
what you're doing with your podcast, that I love. I was not a very, and still am not really a very public person, but there was just something about this that called me to post about it. Um, I could not go through this privately and not tell people, go get your mammograms.
yeah.
I just felt a calling to advocate for people to get their mammogram, because I wouldn't have known had I not gotten a mammogram,
Mhm,
because my doctor said it was so small that there was no other way for it to be seen. I couldn't feel it. And
mhm,
so even if I did a self exam, I wouldn't have felt it. And so I went on Facebook and posted my experience. And, um, it was not for attention. It was not for anything else but to share and hopefully, get the word out to get your mammograms. And I tell you, the amount of messages that I got back, I mean, obviously people were wishing me well,
mhm,
but the amount of messages I got back in on my posts and in private, that because of you, I went and got my first mammogram. And these were
mhm.
people that were our age.
Yeah.
And I could not believe it, that they had never gotten a mammogram before. I'm 53. And so for someone, well, I guess I was 50 at that time, but
But even
you
so,
know,
yeah.
yeah, for our peers to not have had a mammogram, I was happy to share this news for them to be getting their first ever mammogram, if that's what it took. And some of them still message me when I do my annual updates, or during breast cancer awareness month I tend
Yeah.
to do more, but when I say I got my all clear, they say, oh, it's time for my mammogram, or I did mine last month, or whatever, and they give me updates. And I just love to see it. And so
Yeah.
we just need to share more, and use Facebook for positive, or social
How
media
about it? Yes.
for positive things.
Yeah.
That's my soapbox message for today.
No, that it's a necessary message, and I want people to really appreciate the notion that you don't have to have a medical degree or a nursing degree to be able to advocate for what is right. Everybody's journey is not going to be just like yours, but the whole point of sharing this information as openly as you have is so that if there's anybody in the back of their head that might think, oh, I do have a family history, and I
Mm-hmm.
haven't kept up with this information. I've been tired for some reason. I've had this weird pain over here. Maybe I should go get that checked out. We are saying today, yes, you should. Yes,
Yes.
you should. And once you have the information, then you make better decisions about how you want to move forward. But if you're guessing about what's going on with you, then nothing can move forward as positively as it should. Information is not your enemy, especially when it comes to your health.
Exactly. Exactly.
And so, 3 years
Three
since
years.
3 years since all of this ordeal, what does we've talked about the annual checkups. Your team that you've now assembled that has treated you through this point, is this the team and it, for the foreseeable future, or is
Mm-hmm.
there a point where they're telling you that it might not have to be as often, or something else might change where your treatment plan adjusts?
Right. So I have since let my radiologist go because I don't need her anymore. I thought she followed me for a year,
Okay.
and once everything looked fine, I actually had to go. I don't know if people know about this, but I shared this with a few people that the scar tissue, you can actually have an occupational therapist massage that tissue, and to kind of break that tissue up to
Mhm.
help, you know, so that it's easier to detect if there are lumps there.
Yes.
Otherwise, you're just feeling the scar tissue, and then you're
Mhm.
not sure, and that kind of thing. So that's just a little FYI. But
Yes.
I've let her go, but I still have my oncologist. I think she follows me for 10 years,
Okay.
um, and we've switched. I'm on medication, estrogen. I think I forgot what it's called. It's tamoxifen, but it's
Mhm.
supposed to suppress the
Mhm.
estrogen. And
Yes.
then I switched to another one called an aromatase inhibitor at my, I think, 5 year mark. And I still see my breast specialist
Mhm.
every 6 months. I'm now down to just one mammogram and one ultrasound instead of two mammograms.
Mhm.
And so, they just kind of follow me. I think she sees me for, I want to say 5 years, but I'm not positive.
Mhm.
Um, so, yeah, they follow me at least five or more,
Mhm.
um, and then the medications. So I've added some medications that I probably didn't want, but they help to keep things at bay, I hope.
Yeah.
And yeah,
Yeah. And now that the girls are older, tracking towards puberty and all the things that come with it,
yes.
have you thought about the, I guess, maybe adding details to the story so
Um,
that they understand that now you're dealing with known history?
right. So yeah, we have added details over the 3 years.
Mhm.
They get a little bit more each time. Obviously they've gone through and seen the process, and usually when Breast Cancer Awareness Month comes around and they see me in my pink or I'll show my, I don't know if you can see my
Yes,
shirt.
Wonder Woman. Yes. I love it.
um, but they, if they have questions or if I just feel like talking about it, or sometimes in school they have to write, things that um, a trauma that they've experienced,
Mhm.
or you know things that have bothered them in their childhood, and um, we'll brainstorm, and I'll ask them, did my breast cancer journey affect you in certain ways? And they'll tell me yes or no.
Mhm.
They're more resilient than we think,
Mhm.
but we'll see later on if they say it did or didn't.
Yeah.
And each one is different, and so
Mhm.
the older one processed it differently than the younger one.
Yeah.
And she tells me, it bothered her in different ways.
Hmm.
And so, you know, that that hits me, you
Yeah.
know.
But it's
So,
not, we're not talking about a disease that came from neglect. We're not
right.
talking about anything that was necessarily preventable, right? We're
Mhm.
talking about you got a diagnosis, you made some decisions, and yes, there's going to be ways that it affects the family, but talking through it, being honest about your journey and then talking through it with your children is the way that they will continue to process, and the family will heal all together. It's
Right.
it's not so much of an individual journey for you anymore, as lonely as clearly it had to be for all the reasons in the beginning.
Mhm.
Now it's something that the family will continue to heal from as you move forward.
Right. And fortunately or unfortunately, I've kind of paid it forward how Vicky helped me process. I've helped two close friends, my aunt and another friend, walk through their journey,
Hmm.
and in this 3 years. So it's crazy that so many of our peers are being diagnosed. And, I guess we're in that age range where this is unfortunately the disease, the
Yeah.
disease age range. But so we want to try to talk about prevention as well.
Hmm.
But like you said, this wasn't necessarily something that I could have prevented, but maybe for them, we can talk about ways that they could possibly prevent it, because you just don't know. It could be environmental, it could be diet, it could be genetic, it could be so many different things.
Yeah.
And so it's hard to know.
Yeah. But like you said, the beginning with the very basic understanding of self-examination
Hmm.
and making sure that you're following the guidelines as appropriately as possible to get in and get a full picture of what is
Yes.
going on, and then make good decisions about how to treat it moving forward. Well, my friend, that
Yes.
seeing your smiling face, even though people are going to be listening to this audio,
Hmm.
but seeing you at that reunion lifted my heart, because nobody ever wants to know that people you care about are are suffering in some way
Hmm.
and having to deal with such heavy decisions. But we are now on the other side of our journeys, and we are doing our
Yes.
best to guide people through all of that tough decision making, knowing that they have even unseen people in their corner rooting for them and trying to give
Absolutely.
them good information. And so your appearance with us here today is one giant step in that direction. So I'm thanking you on behalf of all the people seen and unseen that this conversation is going to help moving forward, and deeply appreciate your time and your candor, knowing that it's going to bless somebody down the road.
And I thank you so much for having me, and I hope it does reach someone. If it reaches one person, then it was well worth it.
Before we sign off of this special edition of Sick With It, we want to share a few helpful resources. The Pink Well Chick Foundation is a nonprofit that inspires, informs, and supports breast cancer survivors and their families. Inspired by the courageous journey of Barbara Watson Riley, Pink Well Chick distributes free Barb's bags of care with chemo comfort items for women who are undergoing treatment. Go to pinkwellchick.org to make a donation and learn more about their initiatives. And the Feel Your Boobies Foundation helps elevate the importance of early detection. They are one resource that distributes free shower cards with instructions on how to conduct a proper breast self-examination, And they encourage you to know your normal so that you are your own best advocate if you suspect that you may have breast cancer. You can find them online at feelyourboobies.com. The Sick-Witted Podcast is a Soul Sanctuary media production. For more information on our health and wellness initiative, to access the wellness providers in our digital resource guide, or to make a donation, visit us at sickwitted.net. That's sick, W-I-T, it.net. Thanks for listening. Subscribe, share, and we'll see you next time.
Oh, that's funky. Sick. Now everybody throw it up. Sick. And now they screaming, turn it up. So I